I'm gonna die today.
That was awesome. Extreme waterslide injuries. Bart has a conjoined twin, and whatever you do, don't say ah. Get ready to laugh.
Are you ready to laugh?
Because today we're breaking down and reacting to all the hilarious medical scenes and ludicrous injuries from The Simpsons. Let's dive right in.
Ooh, there's new marshmallows in the Belfast Charms.
No, that's Bart's cereal. It's the only way I can get him to take his vitamins.
Whoa, okay. Focus in. Yeah, there's not really a med for that. Could be medication similar to what we would use for ADHD, like Ritalin or Adderall. Prozac is supposed to probably be Prozac. Crystal meth is a stimulant, probably trying to tell us crystal meth, which is not good for us.
Eat up!
The sum of the square roots of any two sides of an isosceles triangle is equal to the square root of the remaining sides.
So interesting. So we had a quick reaction. So medication typically does not work that fast. Most of the time when we take pills, it usually takes 30 to 45 minutes for them to start working.
I couldn't unwrap it.
I got you, Grandpa!
Whoa.
Hold, Polo, hold.
He's holding his grandfather by his neck. This can compress the trachea because the trachea has compressible rings around, and it can decrease blood flow in and out of the brain or the head and the neck area. Oh. Hitting the tree, head injury. We always worry about not just the head, but the neck. Look at that neck! As well as any other body part that might be trying to stop yourself from falling. We would do a quick assessment, not move the individual, see if there's any pain anywhere, poke and prod a little bit. Sometimes you'll put somebody in a C-spine precaution in the pre-hospital setting.
Please be okay. How deep is your love? How deep is your love?
Started to do CPR. Not bad. Got the good hand positioning. Probably be easier if you're a little bit more sideways. Remember, you have to try to do it at 100 times a minute. One of the classic songs is Staying Alive.
Boy,
Yes, Grandpa.
kiss my forehead.
Oh, probably depictions of moles. The moles have hair in them, which is quite normal and fine. As we get older, we get more skin lesions, but we definitely need to go to the dermatologist when we get older just to make sure that all the skin growths are not cancerous or abnormal.
I'm gonna die today.
That was awesome. As Bart's doing CPR, it'd be advisable to call 911 or to get an AED, so an automated external defibrillator, or both.
Look, children, that giant clam appears to be opening. This could be a wonderful journal entry. Look at the size of those flawless pearls.
Oh my gosh, Bart's buttocks. Bart only has a snorkel. It's not something that you can breathe with underwater. You can exhale, but you can't inhale. You'll get water in there.
Bart, get out of there!
Oh, octopus, turtle, hammerhead. Oh my gosh. We see people who have marine injuries come to the emergency department, especially in Southern California. You always have to worry about different bacterias and microorganisms that live in the ocean, especially if you have open wounds.
My poor boy, will he be all right?
Marge, this kind of injury is surprisingly routine.
Things that we would commonly see would be like jellyfish stings, stingray stings, and a lot of other sea creatures that you just have to be aware that they are around, but the majority of the time you're going to be just fine.
Bart will be up and underachieving in no time. All I need is your insurance card.
So interesting. Doctor asking for insurance card. We do not do that. Our system is to get the patient quickly registered, just their name and date of birth, basically, to get them in our system and then be able to be seen by a doctor, a PA, nurse practitioner, ASAP. Steps after that would be to confirm your insurance or see what we can do for the individual.
My husband has our card.
No problem.
Oh my gosh, that does not happen. Even if you didn't have insurance on you or they couldn't find it, even though you had insurance, they can always backlog it and figure it out. Springfield Weight Loss Center. We're no longer a hospital because no one's sick anymore. That would be great. We see so many patients and you'd be like, oh, you wouldn't have a job. You know what? I like the skills that I have. And if I don't have to see so many patients, that means people are healthy and living their best lives. I'm okay with that.
$900 a month? Why is it so expensive?
Health insurance stopped covering it, and the pharmacies are out of stock. The first priority are the people who need it the most.
The people are actually sick?
No, A-list Hollywood stars.
Insurance not covering medications. Again, not my specialty, not my realm, not even the playing field that I am in. Sometimes there are medications that I would want to prescribe to you that insurance doesn't cover, might be too expensive. There are alternatives for the general medications out there. There are a list of $4 medications. Sometimes they're even cheaper.
So where did you get yours?
Oh, I'm not on it. I lost this weight naturally. As a doctor, I know the value of diet and exercise.
You've been a doctor for 20 years. Why didn't you lose weight before?
Get out.
I'm assuming they're talking about the GLP-1 inhibitors that will help reduce weight. The good part about that is you're decreasing the complications of weight-based disease processes. Metabolic syndrome, diabetes, cardiovascular disease, those downstream issues relating to weight.
Here you go. Pure, uncut Ozempic.
Oh, Ozempic. All right, that's really funny. Obviously, trying to make a joke about Ozempic.
Guaranteed to reduce the labanza. It's the antipasto.
Where did you get this?
Let's just say a truck lost a little weight passing through Springfield.
I do see people come to the emergency department every now and then on these medications with some GI issues. There are things that we do worry about, like pancreatitis or gastroparesis or gastritis. I'm not seeing it a ton. Other side effects relating to the thyroid, very rare tumor that can develop. But again, you're monitoring these things, the likelihood is pretty low. Just something to be aware of.
Yes, I remember Bart's birth well. You don't forget a thing like Siamese twins.
I believe they prefer to be called conjoined twins.
It's so interesting. So that's good with Lisa saying, you know, conjoined twins versus Siamese twins. Over time, medical terms do change, not all of them, but it's due to the fact of making them more up with the times or making them more accurate versus like describing actually what it is. So that's normal.
Now, normally the birth of Siamese twins is a joyous occasion, but unfortunately, one of them was pure evil.
Conjoined bodies, people live together like this. It just depends on how they're connected to each other or what they're sharing, different organs. There are some amazing stories out there where doctors were able to separate versus times when you can't separate these individuals because of the shared organs that they have. Oh.
I think I'll bottle feed that one.
Bottle feeding meaning I don't want the breast tissue to get destroyed. We do see people that come in either have a blockage of your glands or the outlet for the milk. We'll see people get infections, something called mastitis. Things do happen from that area.
It was then I knew the only option was to separate you two immediately. You'll both need to sign these.
Ah, that's really funny. That's not the way you would do it. You would need to make sure that all the vessels are okay, the nerves, that they're not sharing specific organs, that sort of thing. It could be quite complicated, or if they're just attached by skin, it might be very simple. We're seeing connectivity in the X-ray, which is pretty cool. Maybe some ribs and skin, so the bones, but maybe everything else is separate, which could make it quite easy for a separation surgery.
The child was an outcast, so we did the only humane thing.
We chained Hugo up in the attic like an animal and fed him a bucket of fish heads once a week.
It saved our marriage.
What? So that's definitely not the humane thing to do. That is awful.
That's awful.
Does anybody out there have a twin that you were attached to? Let me know in the comments, or not attached to.
Say baby.
What the? We got the heart, we got the stomach, and we have intestine. The anatomy of the heart looks great. We got a stomach with maybe the esophagus attached to it. The attachment anatomy doesn't 100% make sense.
I'm dying. And there's heaven. But who's that? Confucius. And Milton Berle. Boy, have I been barking up the wrong tree.
Could Flanders talk afterwards? So the heart is gone, you're not beating anymore. You'll probably be able to survive a couple more seconds and then you'll pass out because you're not getting flow anymore. You will die very shortly after that.
Oh, nice posture.
Oh, thank you. Mother always said a curvy spine is the devil's roller coaster.
Actually, a curvy spine is actually pretty good. So you want to have a curvy spine more like an S, having to do with lordosis and kyphosis.
Hey, you can't have that.
Could you go in and rip somebody's spine out? No. If somebody's spine did come out, you're also taking out the spinal cord. So when we refer to the spine here, we're talking about the whole thing, the spinal cord plus the bones. And the bones are super attached to like a gazillion muscles.
Lost your spine, huh? You just keep finding new ways to disappoint me.
Would you be able to talk? Potentially, you know, depends where the spinal cord was ripped out. As long as your brainstem is still intact, you'll probably still be able to talk, but the issue ends up being able to move your diaphragm so you can breathe.
Relax, honey. You were just having a crazy nightmare.
Obviously, Bart is having a nightmare.
Bart's nightmare.
But you know what causes real life issues like mood swings and emotional outbursts? Lack of deep sleep. That's why I created Do Not Disturb, a doctor formulated sleep aid to help you drift into calm, hopefully nightmare free sleep. Find it now at lifehappens.com or on Amazon.
You're back with your family now where there's nothing to be afraid of. Except that fog that turns people inside out.
Huh?
Do we have gases that turn people inside out? No, but there are toxins out there that can cause your skin to break down, almost like melt away.
Uh-oh.
What?
It's seeping in. Stupid cheap weather stripping.
Kind of a funny, good job of trying to show blood vessels underneath the skin. Could you survive without your skin for a little bit of time? But the skin is the largest organ of the body and we do need it. Oh my gosh, I love the Simpsons. These are hilarious. These are very funny. And again, they continue to give us good medical topics to talk about. If you guys enjoy this, definitely binge watch this whole playlist right here. And as always, make sure you subscribe, turn on your bell notifications, and hit that like button for me. Thanks so much for watching and stay healthy, my friends.